Assalamualaikum warahmatullahi wabarakatuh. To my niece and my fellow classmates, today I will be presenting about first aid management. First of all, my name is Muhammad Adam Hafi, DPC04220035. To begin with our presentation, let's take a look at our situation. One day, you and your friend are doing usual experiment in the laboratory or lab. Unfortunately, one of the apparatus containing chemical substance broke in front of your friend's face. You, as a first aider, what will you do if you are in this situation? So, without further ado, let's think together. So, the first step that you have to remember to first aid management is call for help. You can either call the lab assistant, the lecturer, or you can even call the helpline, such as 911. And make sure to move your friend to someplace else that is safe. Why? Let's take a look. Now, the several factors that you needed to move your friend to someplace else that is safe is to avoid the crowded place. Because, as we know, if the incident happened, many people would come and just watch your friend, and the oxygen that your friend needed will currently go out. For the safety of the injured person or the surrounding, you have to prevent the place to be crowded with people. Secondly, is to avoid the post-incident such as microorganism affection, because we don't know if the people or the surrounding is clean and free from microorganisms. So, remember to wash your hand before handling the patient or the injured person. Secondly, is to avoid the further explosion of the apparatus, because we didn't know. For example, we are doing the experiment that involves playing with fire such as the Bunsen burner, so we didn't know that friend has turned off the Bunsen burner. Lastly, is to prevent further incident in the crowded environment. For example, in the time we move the injured person to someplace else, the person that in the front of the way, we don't know if we just push them down and it will cause the further accident to other people. So those are the several factors that you needed to know why we needed to move the patient to someplace else. And if you already done the step 1, congratulations, you have accomplished the first aid management 1. Now, let's move on to step 2, which is you have to know the type of injury the person acquired. The first type of injury is bleeding. Meanwhile, the second one is burns. And now, without further ado, Let's move to our type 1 injury, which is bleeding. The most common bleeding that can happen in a lab is a laceration wound. Now, laceration wound can happen when the skin layer is cut by sharp object such as knife or scissor or anything that is sharp. The deeper the wound is, the more blood will come out. And what happens if the person lose too much blood? Yes, the person will lose unconscious. So this is a several type of laceration wound that can happen. See the opening wound on the skin layer on the first image and the second image. The second image shows a laceration wound on our hand, and the second image shows the laceration wound on the finger. See all the those blood that come out from our skin. So if you have know the type of your injury, let's move on to the treatment for the cuts. Firstly, open the tap water in the lab and let the water flow for 10 to 15 minutes, and just put your hand in the water and let the water to flow throughout to your hand. And the most important thing you have to remember, don't use water that is not flowing. Because why? Because the water that is not flowing will easily contaminated with microorganisms, and this will lead to the infection of the microorganism. And after 15 minutes have passed, take a clean towel or pad or gauze that you can find in the first aid kit to stop the bleeding by two methods. The first method is directly pressure the clean towel or pad or gauze to the wound to stop the blood to come out. You have to pressure as hard as you can. The second method is to elevate the wound to higher level so you make sure the blood doesn't go out to the wound. And after you have cleaned the water and the blood has stopped, use antibiotic cream or alcohol to prevent the contamination of microorganism exposure, because as we know, the wound is open up our skin layer, so the microorganism can easily go in and infect our inside body cell or even spread throughout our body and infect our organ. After you have applied the antibiotic cream, close the wound with plaster or clean cloth after using antibiotic cream. And if the wound is big, go to the hospital for getting a stitch if the wound is big. Now those are the steps to treat the laceration wound. Another common bleeding that you can acquire when handling experiment is punctured wound. Punctured wound is caused when sharp or pointy object penetrate into skin layer such as knife scissor, or anything long that is sharp or pointy. It may be causing internal organ damage if the object is deeply pierced. So, this is an example of a punctured wound. What you need to keep in mind is immediately call for help and don't try to pull the object out because you will make the situation worse and worse more. So that is a type 1 of injury, which is bleeding. The type 2 of the injury is burns. Let's move along. Burns can happen when skin layer is exposed to fire, heat, or anything hot that causing the skin to turn black. And it will even worse, the blood will come out and our body will lose a higher amount of fluid. Now, firstly, as we remember, the first step of first aid management is to move the person to the open space. In the term of burns, we have to move the patient to the open space so that the patient or the injured person can get a needed supply of oxygen, because as we know, if the people is crowded, look at the injured person, oh my god, the oxygen will currently go out. And on the other hand, try to use fire extinguisher if the person is trapped in fire or the environment is on fire. And it is important to check the person airway and provide oxygen if required. So the first step, check the person is still conscious or unconscious. You can proceed to CPR, which is cardiopulmonary resuscitate. And you have to remove any item that can even worsen the contamination of microorganisms. Now, what to do if the person is exposed to the chemical burn in the eye? Let's think about it. So, the first step to treat the chemical burning in the eye is make sure to shout so that everyone can clear the way for you to prevent the crowded place. And remember, don't exceed 15 seconds to prevent further burn in the eye. Remember the 10 to 15-second rule. Second step, in the lab, usually they will provide the eye wash station or the body wash station. So, go to the eye wash station and turn on by pressing the push button. And thirdly, the most important step is to bend down your body to forward and tilt your head to the side that you have chemical burn in your eye, and let the water to flow for about 10 to 15 minutes. Always remember to open your eyelid using finger to make sure the eye is washed properly. And lastly, don't forget to move your eye every direction to make sure every area is washed with water. If your friend is wearing a contact lens, immediately open if you are wearing a contact lens. Because why? To avoid the chemical to be trapped in your eye. In the other hand, to make sure the water is separately throughout your eye. And the last step is to refer to the expert if needed or further step is required. So that's all for me to begin with the step 2, the first aid management. These two are the reference that I use to acquire the information for my presentation. As you can see, the bleeding one and the burns one. So that's all for me. Thank you for listening and have a great day. Assalamualaikum warahmatullahi wabarakatuh.